Fine, good morning to one and all, and respected teachers on the dais. I will present on a very rare disease known as Trabulosi syndrome, which I encountered. When the 39-year-old male complained with chief complaint for the diminution of vision in the right eye, complained of low vision for last few years, and complained of outward deviation. This is a main complaint. Patient social status was very poor. Patient came from Jammu Kashmir. This is the initial photo. When you look at it, by looking at the picture, you can see something is not normal apart from divergent squint. So there was a clinical examination. There was a diffuse blade-like structure around the limbus, IOP of 6 millimeter in the right eye and 10 millimeter in the left eye. No history of any surgery, no history of any trauma. In the right eye, there is CDL positive at 3 o'clock. Younger brother have similar picture and no photo was there. And there is history of consanguineous marriage. If you look at the picture, it's like a convex iris configuration here. Convex iris configuration with lower tip and lower nose. So anterior examination, if you see there is this corneal anomaly or there is a thin cystic blade-like structure here. If you see here, there is a blade formation in the right eye. In the left eye also, there is superior blade formation, or you can see here in the blade area. So if you see there is jet black pupil and see there is a CDL positive here. You can see if there is CDL positive, and if you see there is a blade black structure here in the superior part. So patchy areas of atrophy in the iris, spontaneous bleb and bleb leak CDL positive. So on dilated examination, you see there is a supranasal subluxation and this microspherophygia. And on gonioscopy, the normal landmarks are not clearly visualized. So the pigmented deposits are here, and this is a broad-based pass, most likely because of angle dysgenesis. We did a Heidelberg bleb and angle. See there is a remnant of iris strand bridge of breathing area this here. On this part, this scan is taken to this part of iris, and this part you see the angle structure is completely destroyed. And on ASOCT also there is a cystic bleb present here. On UBM also you see there is clear, you can see 35 megahertz we did, and with this there is a thin cystic part. And on OCT there is, if you see the normal macular activity is not there. So this is confirming the hypotonic maculopathy. There are coronal folds present there. So if you summarize, there is spontaneous bleb is there, bleb leak, microspherophygia with subluxar crystalline lens, big nose, exotropia, gonioscopy angle dysgenesis is there, macular OCT hypotonic maculopathy, UBM there is a bleb and cystic space. So when you search the literature, we found this is related to the Trabulosi syndrome with similar features is there. So on online Mendelian inheritance of man, on the where the genetical diseases are reported, the large big nose, ectopia lentis, patchy areas of atrophy, and a vascular elevation of bulbar conjunctiva. So what really happens in this disease, there is a gene mutation in the 8 chromosome 8 and asparaginal beta hydroxylase, which adhere the cell. So this molecule is deficient, so which leads to the spontaneous bleb formation. Only 28 cases has been reported on 11 and 11, and in India till now 6 cases are reported. This case is to awaited reporting. What we did a bleb revision by doing conjunctival advancement to correct the hypotonic maculopathy. Patient never came for visit for any follow-up or genetic counseling. What could be happening, or what can be the ophthalmist can do? So there might be progression of sclera thinning because of the genetic deficiency, blebitis from the bleb leak leading to the bleb related endophthalmitis in other areas of where the spontaneous bleb is formed. So in these scenarios, what can be done? There can be clear corneal lensectomy can be done. Iris claw lens question mark because there is patchy areas of atrophy. SFIR also should be avoided because of progressive thinning of sclera. So might be contact lens might be given in such scenarios by doing clear lens corneal lensectomy. So genetic evaluation of whole family member needed. So on conclusion, I will say a personalized approach to disease management needed in such scenarios. Prophylactic measures associated with the secondary complications and need to follow up these patients. Genetic disease orders are believed to be incurable. Further genetic counselings are needed. The purpose is this is a very rare case. When we face this stage, when we searched, we first time knew there was something called Trabulosi syndrome also this existed. Thank you so much.
Thank you very much. I just wanted to ask you that it's all happened by itself, isn't it?
Yes, sir.
So what was the location of the bleb formation?
Sir, in the right eye, it is on the supratemporal, supranasal, and nasal part. On the left eye, it is almost from extending from 8 o'clock to 12 o'clock, and in the nasal part. On the right eye, there is a bleb leak.
And were you able to determine the scleral thickness in any way?
No, sir. Sclera thinning.
Did
we,
you
we did an associated picture. There is seems to be sclera thinning, but we didn't measure it.
Okay. Did you do an ultrasound to find whether there was a leakage even posterior to the globe?
No, sir. Posterior globe means hypotensive maculopathy is there.
Behind the eye, actually.
No.
So no.
No.
Okay. And what has been the general recovery pattern of these patients across the world? You know, with
Sir, the case report they have suggested there are many most cases they do provide contact lens, which gives protection because the lens is removed. They don't can put a lens and they cannot do an SFIL. So in those scenarios.
Yes.
Just one question. You said there are only 28 reported cases, right? So how did you confirm this? Did you go for a genetic kind of a
Sir, genetic
test?
counselors
Because that
evaluated.
is what is probably confirmatory.
Yes,
Otherwise, the rest of the symptoms they are vague, basically.
Yes, sir. All the symptoms
I
match
mean, the signs and the symptoms. I
Yes.
mean,
All the signs and match is that the patient was called for genetic counseling, but the patient didn't came for follow-up, any follow-up. For father was, her brother was also same disease, but cannot took a picture.
The patient has to be confirmed genetically.
Genetically, yes.
Number one. Number two, you said spherophakia, microspherophakia. That's
Yeah.
a very specific term. See,
Huh.
in this condition, it has been reported simply as ectopia lentis. How did you diagnose microspherophakia in
If you
this
see the
case?
pupillary size, sir, compared to the pupillary size, the lens appears to be very small. If you see the
The
image,
people is dilated in this case, I
yes, sir.
presume.
So, even
How did you diagnose microspherophakia?
The
This is
clinical
not the way you diagnose microspherophakia.
if okay.
And there's no microspherophakia documented in any of the literature available. It's simply ectopia lentis.
Yes, sir. In cases, acute glaucoma is then
It's
reported.
not question,
with
okay, I'm talking about this particular disease.
it's Trabulosi syndrome.
You have used it, I mean, just like that, jabki it's not seen in, not documented anywhere in the literature. Microspherophakia, it's a very specific term, please avoid it.
In Trabulosi syndrome, they have reported the anterior migration of lens and
They have reported simply ectopia lentis dislocation.
okay.